What's up, everybody? I am coming today to basically do a what's inside my emergency bag. I've seen a lot of videos when I was trying to prepare my medical bag, and they were a little bit intimidating because they were, very elite items and items that normally hospital medics use. And so I kind of wanted to see a video where a mom of, of a few children would use. And so I didn't find a lot of those. So that's another reason why I'm making this video. But also I am replenishing what is in my emergency bag because it needs refilled. So basically, I live in the South, but I'm coming from the North, and um, it is hurricane season. So one of the reasons why I got to re-up on my bag, and I'm actually a little late, is hurricane season started June 1st. And I kind of wanted to have my medical bag already packed because one of the things that I go over with my family is whenever it's an emergency, we just should be able to grab and go. Not have to search and find, but just grab and go. And so this bag should have been packed, but I'm also a procrastinator, so therefore, sorry. But not only due to hurricane season, but even I take my medical bag when we go on vacation, when we go to the beach, when the kids got sports. I always have my medical bag because it comes in handy. So, yeah. So let me get started. So this particular bag, the color red always symbolized emergency to me growing up as a kid. And I kind of wanted to keep that same color. For my children. I've seen some other people use green, and I've seen other people use like bright orange, but I want to stick with red. It's just a familiar color for emergencies, and it's easy to find. I got this on Amazon. I don't remember how long ago I purchased it for, but I know it couldn't have been that expensive because I'm a little cheap. But anyway, I like how the bags have the clips in the front, and it has a lot of pockets, and that's what drew me to like the bag. So inside of the bag, not much is really in here because I have to refill. But of course, I have certain items such as my stethoscope, and I have some Dermoplast. I actually have too many bottles of the Dermoplast in here, and some other stuff. But I'm just going to take out a lot of this stuff, and you'll see me put some stuff back in. And it's very important to go through and clean your medical bag often because medicine can expire. A lot of different things can expire. And as you can see, like I got rollers. My kids been in here, not that they've been in any medicine or anything, but I'm saying dropping stuff in the bag and stuff like that. So I just have to make sure I keep it cleaned out, and then I go through it every so often to make sure that everything, like I said, is in there and that nothing has ran over an expiration date and all of that other stuff, and make sure that I have everything. So I'm going through right now. What I'm doing is I'm going through all of the pockets, and I'm taking everything out, making sure that I'm starting anew with the stuff in the bag because I have to replenish a lot of stuff. So that's what I'm doing right now, is going through and emptying out any type of trash or whatever. I have sand in the bottom of this bag, a whole bunch of stuff because, like I said, we take it to the beach and all of that stuff. So I'm going through and I'm just emptying out all of the pockets in this bag. All of the usable pockets, should I say, because I have pockets on the side, but these pockets on the side are stuffed with things, and I'm actually going to show you in a minute. And bear with me because I'm using one hand to do this video. I don't currently own a tripod, or I had a tripod and my kids broke it, so I don't currently have one. But this side I really don't have to go through much, but I have a splint on one side, and then I also have a CPR mask, which I'll break down and show you in just a minute. Excuse me. And then this goes to the CPR mask. And then on the other side, which I might have to go through, I had some things like some scissors, an emergency blanket, and some gauze. Okay. And some oversized pins. And yeah, so that side I did have to go through. There's no pockets on the back or anything like that. It has a very decent and sturdy strap, which I like about it, which is adjustable. And that's just about it to cleaning everything out. I'm going to actually take and shake the sand out of it, and then we're going to go through and just refill everything. If you just give me a minute. Go through some things that I keep in my bag, and you'll hear a bag rattling because I also had to go re-up on a lot of things, so I had to stop at the store. But let me start filling it with the stuff that I already have, and I'm just checking dates and making sure that everything that I have is, you know, what I need. So this I got this from a company that was selling medical stuff. So this is Line to Design EMS and Fire Supplies, the Mylar emergency blanket, waterproof, retains heat and cold environments. I feel like everything in the bag you would never hope to have to use, but I make sure that I keep that in the bag, and I normally keep that on that side pocket. I have an Insta-Cold compress by a company by the name of McKesson, and this is a 6x9, and I make sure that I keep this in the bag as well. Okay, and so along with this cold compress, I have a instant hot pack, and I keep that in there as well, because some wounds and some breaks and stuff that you get requires hot, and some require cold. Sometimes, you know, if you have a break, you may need, you know, cold, and if you have swelling, you may need hot, depending, you know, it just all depends. And I want to make sure that I have the right one, so I make sure I keep one hot and one cold. I have I'm one-handed, y'all, so don't judge me. So I have these exam gloves that I like to keep on hand, and I actually ran out. So now that I got some more, I'm excited about that. And I normally just like them, keep them in here visible so that I can see and I know where they're at. I also like to keep these, which are face masks, and you get a 10 count. I got this from the Dollar Tree, and not that I need 10, but I do like to keep these on hand. I know that if it's like a stomach virus or anything like that, you know, sometimes I like to get these on my smaller kids, especially my 3-year-old, because he has a very frail immune system. So I like to keep these on hand as well, just to make sure that I have. And then on the same side, I got a pain relief patch. It's a cooling pain relief patch, and this one is a heating pain relief patch, and they go the same with the same back there, heating and cooling. One is a patch, and these other ones are a pack, hot and cold pack. So as well, I got this from the Dollar Tree as well. It's actually a you fill this with, you could fill it with cold water or ice cubes, which is really, really easy. Some people got the ones that you have to fill up with alcohol and water so it can freeze or something. I don't use that. So I just keep something like this around, because again, if I ran out of these, or if I have multiple people that I'm attending to, this comes in handy as long as there's ice or cold water around. Or even if someone hits their head, it's kind of hard to have this bag on their head versus this, so it will conform to whatever. So I keep that in there, and I'm making sure I'm trying to keep stuff in there pretty decent, nice and neat. Okay, so then while I have this area open, I have this tongue suppressor that I keep. It comes in handy if children are choking or something is lodged in the back of their throat. When people are in panic, they tend to like frail, and you know, if you can get their tongue suppressed down so you can see back in that area, just try to see what's lodged back there. Sometimes it can aid in even pushing it down the throat, or you know, helping it bring up the throat. So bring it up the throat. So I like to keep one of those in there. I got a pair of medical scissors, and why it was important for me to get medical scissors, because I realized that regular scissors, I would cut through bandages and they were not, regular scissors were not working. So I just took a little bit of money and invested in these medical scissors. I think these cost me like $3, $2, really not that much money at all. So if you get a chance to get you some medical scissors, do so. Also, from the Dollar Tree, I got this light, and it's very bright. I'm gonna try to shine it the opposite way. It's very, very light. It flashes. It does all of that jazz. And so I just went ahead and picked one up because, again, it's important. If it's dark around, or if you're in a not a well lit area and it's a headlamp, that's the best actually lamp to have, because if you're trying to help somebody and it's just you and them, and just like I have with this camera, if I'm working with one hand, I don't want to take my other hand away by using it for a light. So, and it's a triangular bandage. Ask me what a triangular bandage is used for, and I can't really tell you, but the fact that it came with the first aid kit, I normally like to keep it in there because it'll be just my luck. I don't know what it's used for, and then I'll find out what it's used for when I need it. Okay, so I put it in that side compartment. Also, I have some gauze, and I have this is rolled gauze, so it's one big piece that's rolled up, and then I have an ace bandage, so I like to keep them in the pocket as well. And then I have some gauze pads, and you get 10 of them in this box. Really good for like a deep cut on the hand or something like that, and you don't want to take and roll the whole roll around the thumb, or if there's a boo-boo on the knee, you don't want to have to roll the whole thing around the knee when you could just use a pad and some tape and some athletic tape. Okay, speaking of athletic tape, I got some athletic tape again from from the Dollar Tree. It doesn't have to be really expensive as long as it works. And my experience with the Dollar Tree is a lot of this stuff works. It's not made to work for forever, but as long as it works is what's important. So I don't try to get the top of the line, because the best thing is if it works and you know how to use it, it's efficient. You know, you don't need $10 roll of athletic tape. This, look, see how hard I'm having peeling it? It works, and it works really good. I've used this before. So put that athletic tape again over there in that pocket. I kind of got stuff placed in places where I've had it before, because I know my eye is almost trained to go to those specific places. I also have another light, and my kids used to love playing with this light, but it's a light kind of to check people's pupils to see, you know, if they're dilated or not. And it actually has a nice little pupil gauge on the side. Because if 911 is asking you questions, it's helpful if, you know, you can provide as many questions to them. And again, I'm not a nurse, and I hope to never have to use this, but I make sure that I have one on hand. So again, that's where these little pockets come in handy. I just slide it right there in that pocket. So while I'm working on that little pocket, let me get this out. So I have a Sharpie, and a lot of people's like, well, what's so important about the Sharpie? Several different things for the Sharpie. So the first thing is, if you have to write something down, I write stuff down on newspaper, napkins, whatever's handy. I'll write something on my hand, on the inside of my hand, if I have nothing to write it on. And you may have to check somebody's pulse and write down their pulse ox. You might have to, you know, I even like mark a wound. So if my daughter, one time, she had this gash on her leg, and we were out going hiking, and she had this gash on her leg, and it was about this big, and so the blood around it was about this big. So I kind of drew a line where the blood was, and if it bled more than where I marked at, it let me know that it was still bleeding, or it was bleeding more. And so I like to keep a Sharpie on hand just to kind of mark some things and make sure that I always have something to write with. In those same little compartments, I also like to keep a digital thermometer on hand. Now, I have some great thermometers around the house. I have the forehead thermometer, I have an ear thermometer, but there's nothing quite like having a digital thermometer. I mean, there just isn't, because, well, you get good reads off of the most simplest of things. So I like to keep a digital thermometer handy. And let me see if there's anything else I can keep in those. I keep in those little compartments up there. Okay, so while I'm working with those little small compartments as well, I like to keep two big safety pins on hand. And why I like to keep these two big safety pins is for things like this and things like this that I have to pin together that may not stay together with the tape. Because if it's on the knee and you got all this constant bending and pressure on the tape might just decide to come loose. So I make sure I keep two straight pins, not straight pins, I'm sorry, two pins, two safety pins in there. Okay, now on this side over here, I have a CPR mask. And so this CPR mask, see the pros and cons of working with one hand. Okay, so this CPR mask, let me try to get it open. I'm not going to tamper with it too much because you want to try to keep it in a sterile state. But this CPR mask, it comes like this, and I think I got it off of Amazon. But I always try to keep one on here because I know that although I'm not 100% germaphobe, I still don't want to be caught in a position to where I have to do CPR on somebody that's not that their hygiene isn't the greatest. Or even that I just don't know them. So I always like to have one of these. And they come with, you get this little thing right here where it's like, it's called a mouth-to-mouth quick saver. And there was another one that came with it, and I don't know where it's at, but when I find it, I'll be able to put them close together. They both came in these in this little bag right here, so I don't mind even discarding the bag just as long as I have the CPR mask and stuff on that side. Also, I have a pill cutter. And why do I have a pill cutter? One or two things. Number one, I learned as a little girl it was very important to have a blade somewhere on you because you never know when you're going to need to cut something in an emergency situation. So the blade kind of doubles as if I need a spear blade. I do like to keep a knife in this bag along with the scissors, but also this spear blade comes into handy. And also, kids really don't know how to take pills. And some adults don't. So having a pill cutter came in handy for me a couple of times. Okay, y'all, I apologize. My camera was getting a little fuzzy, and I think I was having a hard time trying to adjust. So next, I like to keep some icy hot on deck. I have kids that play sports, and this actually expires in 22, so this is good. So I go ahead and just put that up in the bag. Also, I have a basic splint. This actually came with this bag, and I've known a lot of people that had to use a splint, and I actually could feel the metal in here. And so they actually give you a how to put this on somebody, or you know which way that you could use this and stuff like that. So I definitely keep the splint in here. Although, like I said before, you will always hope to never have to use these things. I still like to have them on deck because you just never know. Okay. Tampons. So I normally put 2 in here, but I used to have about 4 or 5 in here, but saving that person by stopping the amount of blood loss by trying to allow the wound to clot. And one of the things that will help clot is by stuffing the wound, and tampons do a great job at that if the wound is big enough. So I normally like to keep 2 tampons in here just for that reason. I had broke into or bit into a very hard piece of chocolate. I think it was an M&M. And it was a peanut M&M, and I bit into it, and the whole, like my whole tooth kind of broke in half. And this Tempur Max helped me over till I was able to get to a dentist. And so I try to always keep that handy and on deck. Keeping in the flow with teeth and stuff. I always keep some dental floss, and I keep some dental floss for a couple of reasons. One, if something is stuck in the tooth. Two, I used to use dental floss if my kids was having problems popping their, getting their teeth out, because sometimes sore teeth that's on the way out can cause a lot of soreness and stuff like that. So I would keep this for that. And also, I would use dental floss also to cut off circulation. So I had a splinter one time that was at the top of my finger, and I was trying to get it out, but I kept bleeding so much that I couldn't even get the splinter. I couldn't even see the splinter anymore. So I tied it off. I tied it really nice and tight. I tied some dental floss, and it really slowed down and reduced the amount of blood that was coming from the tip of that finger. Stethoscope. With me as well, because again, I have a child that suffers from low blood sugar, and sometimes the symptoms can be severe. And one of the things that a paramedic may ask, or a 911 operator may ask, is, what is his heart rate, or can you tell me what his heart sounds like? And so keep Carmex in this little bag. There's nothing worse than blistering lips. And in the sun, sometimes lips can chafe up and blister and cause a lot of pain. So I normally keep some Carmex. I keep some earache drops. And it's good to keep eye drops as well, because my kids go swimming. So sometimes the chlorine agitates their eyes. Or even if they have something in their eyes, sand or anything like that, eye drops definitely come in handy. And I got this from the Dollar Tree. I am allergic to aspirin. So my husband used to find it funny that I kept aspirin in this bag. But I keep aspirin in this bag for a few reasons. The first reason is aspirin has been known to prevent heart attacks. So I also, for that same reason, keep Excedrin, because not everybody can do aspirin. So for pain meds, I definitely keep both of those on deck. I have, and I keep Pepto-Bismol because of tummy aches. To keep some throat lozenges in here as well. Why throat lozenges? Because itchy, scratchy throat and all of that jazz. So I keep some throat lozenges in there. I like to keep Premium Petroleum Jelly. Whether it's regular petroleum jelly, creamy petroleum jelly, whatever so have you. When my kids get brush burns, I clear them off, wipe them off, make sure they're clean, do the alcohol, I mean not the alcohol, but the, was it peroxide? Whatever, but I clean it and I make sure, it's very cleaned up and well. And then before I seal it up, I either put a healing cream on it, or I put, petroleum jelly on it. And why? Because it slows down the amount of mat bleeding that it's doing. And it also kind of gives it the availability to keep clean. Because any dirt or anything they get on it will stick to the petroleum jelly. So I like to keep that around. Claritin. I have a few children with allergies. So, okay. So I also have some athlete's foot cream that I like to keep in there for like itchiness. Believe it or not, my son used to get the most horrible diaper rashes known to man. And his doctor one time recommended, as you can see on there where it says comparable to Lotrimin, he actually recommended Lotrimin. And I was like, that's anti-foot fungal. I'm not putting that on my baby. Yada, 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 yada. And I was broken down one time because it was hurting him so bad. And he was in so much pain that I actually decided to try it. I went to bed, woke up the next day, and the rash was daggone near gone. And so I keep this on deck because even with wingworm, poison ivy and all of that, like, it does really good at minimizing the itch and taking it away. So I make sure I keep some Absolute's foot cream. And then I also have some bug bite relief. I don't know how good this works because I generally never buy it from the Dollar Tree. I know everybody's like, girl, I ain't say you put no Band-Aids in there. But girl, listen, I'm going to do the Band-Aids last because I'm going to tell you about having kids and Band-Aids. I like to keep, I think this is called Cepacol, whatever. It's sore throat. It actually, what it does is it numbs the throat, and it relieves throat pain. So I like to keep a little. When I say little stuff, I have some things that came with the kit, such as this insect sting relief. I also have these things called antibacterial hand wipes. And then I have a little instant thing of aspirin. Again, these came with this kit. So I'm just making sure that the expiration date is not out. And they're okay. And then I have a couple of things of Curad, which I'm going to place back in here because this Curad triple antibiotic comes in handy, especially with cuts and all of that jazz. So I'm going to keep some of that in there. And then I have some Band-Aids. I have a variety pack of Band-Aids. And I also have some of these flexible fabric Band-Aids that I'm going to put in there. So thank you for sticking this out with me and have a great one. Toodles.